great Neutrogena event to educate our ethnic community about the importance of sun safety and learning what great ways we can really get on top of this, protect our community, and prevent skin cancers. So I want to start off by talking about the myths that we have about the sun. And that really changed for me when I myself became a doctor and started taking care of patients when I was an intern. I had a patient who was Middle Eastern, and he died of a melanoma, and he was in the hospital. And that was the first time I realized, oh my God, this can happen to me, and just because I'm not blonde doesn't mean I'm not going to get skin cancer. And in fact, I'm sure I'm not alone, because many of us have been kind of targeted outside because we're ethnic, and most of the propaganda and education about skin cancer has been directed towards the Caucasian population. However, the rate of increase in melanoma, that's the type of skin cancer that kills people, has increased 2.9% over the last 15 years in the Hispanic community. So that's not much different than the Latin community, and then the Caucasian community. And I want to talk to you a little bit about what we can do about this. So let's talk a little bit about what skin cancer is. So there's different types of skin cancer. The first one that I'm going to talk to you about is called basal cell skin cancer. And it's not the same basil that we eat. It's not really an herb. It comes from the basal layer of the skin, and it's the most common type of skin cancer, and it's directly correlated to UV radiation. In fact, about 2 million cases were diagnosed in 2010, just in the United States alone. This is not including the other parts of the country. Now, the lucky thing about basal cell skin cancer is that usually it's like a cavity in your tooth. It's locally growing, it doesn't leave the skin and go elsewhere. But it is locally destructive, so it can erode right through the tissue and cause a lot of local destruction. The second form of skin cancer I want to tell you about, the middle column, is called squamous cell skin cancer. And that usually arises from what we call the pre-skin cancer, or an actinic keratosis. Most of these cases are associated, again, with UV radiation and excess sun damage. About 250 cases per year in the United States. Now, squamous cell skin cancers are a little bit more aggressive than the basal cell, in that 1% of the time they can leave the skin and go to the other organs, what we call metastases, and cause even death. So there are people who die of skin cancer called squamous cell carcinoma. But nothing is more devastating than tragic than missing a melanoma or not protecting yourself from this death-causing skin cancer. Now, melanomas are less common. About 8,650 cases of melanoma are diagnosed. But if not diagnosed and treated early, they can actually cause death. Now, the ethnic population is especially missed because most people don't think to look within them. There's a special form of melanoma called acrolentigenous malignant melanoma that shows on the palms and soles of ethnic colored people. Even black people can get melanoma. And if misdiagnosed, it can cause death. So, having said all that, what can we do to be smart about this, to educate ourselves and not end up like this? Well, the answer lies in UV protection. So what can we do? Well, of course, using SPF is an easy solution. Just put that on. If you are going to be outside for a prolonged period of time, reapply it. Make sure that you're avoiding the sun in the peak hours. Just common sense. 10 o'clock in the morning till 4 is peak time to be burning. So being really careful to protect your skin during that time. And using good and right choice of SPF. And I can't emphasize that enough. A lot of times the sunscreen that you use can actually make you more sensitive to the sun, or after an hour it just wears off. So you're actually not protected at all from the UV rays. So there's something we can do to basically protect ourselves from getting skin cancer and not ending up as a tragic case of melanoma.
Thank you.
I just want to re-emphasize how important it is to use sunscreen. And I'm a member of the ASDS, and we did do the cancer screenings, and we do appreciate Neutrogena's support. And everybody who came in for the free cancer screening walked out with some nice bottles of the Neutrogena SPF. So that's very important to use your SPF and get regular skin checks and make sure that we're keeping everybody healthy for a lifetime.